Have you ever noticed a new spot on your skin? Or perhaps an old mole that just looks a bit different? And a tiny voice in your head whispered, "Should I be worried about that?" Many of us, especially as we get a little older, tend to dismiss these whispers. We might think it's just another sign of aging, or a harmless mark that's always been there, just more noticeable now. But what if that tiny voice is trying to tell you something truly important? Something that could profoundly impact your health and even save your life? This reluctance to check, this tendency to overlook, is a painful reality for many, and it often means we miss critical messages our bodies are sending. Our skin, the largest organ we have, is constantly communicating with us, often in silent, subtle ways. It's like a daily report, but we often don't know how to read it. The secret is that skin cancer, especially in our golden years, is far more common than many realize, and it often presents itself in innocent-looking ways we might easily overlook. It's a silent conversation our skin tries to have with us. If only we know how to listen and what to look for. In this video, we're not here to scare you, but to empower you. We're going to unveil some of these quiet signals, these silent cancer signs that can appear on your skin. We'll look at changes in moles, new spots that seem to appear out of nowhere, and even seemingly harmless rough patches that could be telling a much bigger story. Understanding these signs can make all the difference. So, please, stay with me until the very end, because I promise there's a vital piece of information that might just surprise you and change the way you see your skin forever. Let's dive right into the first crucial area of concern, one that many of us are somewhat familiar with, but perhaps not to the depth needed for true vigilance: our moles. We all have them, don't we? Those little freckles and beauty marks that dot our bodies, some since childhood, others appearing over the years. But sometimes, a mole isn't just a mole. Sometimes, it's a silent messenger. The key here is not to panic about every single spot, but to learn how to distinguish between a typical, harmless mole and one that might be ringing an alarm bell. The most widely recognized guideline for checking moles is often referred to as the ABCDEs of melanoma. Melanoma is the most serious form of skin cancer, and while it's less common than some other types, it's crucial to catch it early. Let's break down what each letter stands for and how to apply it during your own skin self-checks. First up is A for asymmetry. Imagine drawing a line right through the middle of a mole. If one half of the mole doesn't match the other half, if it looks lopsided or uneven, that's a red flag. A common, benign mole will typically be symmetrical, meaning if you folded it in half, the two sides would match perfectly. But if you see a mole that's an odd shape, with one side clearly different from the other, it's time to take note. Next, we have B for border. Look closely at the edges of your moles. Are they smooth and well-defined, like a perfect circle or oval? Or are they irregular, ragged, notched, or blurred? Melanomas often have borders that are indistinct or uneven, almost as if the pigment is spreading out in an uncontrolled way. Think of it like a shoreline. Is it a smooth, sandy beach, or a jagged, rocky coast? We're looking for the jagged, rocky ones here. Then comes C for color. This is a big one. A typical mole usually has one uniform color, whether it's light brown, dark brown, or black. But if you notice a mole that has a variety of colors within it, different shades of brown, black, even red, white, or blue, that's a significant warning sign. It's like a painter's palette gone wrong on your skin. Multiple colors, or a sudden change in the existing color of a mole, definitely warrants a closer look by a professional. Following color is D for diameter. Most melanomas, when diagnosed, are larger than 6 millimeters in diameter, roughly the size of a pencil eraser. Now, not every large mole is cancerous, and some small melanomas can exist. But if you have a mole that's larger than 6 millimeters, or one that's growing rapidly in size, it's something to be concerned about. It's always good practice to keep an eye on moles that are expanding, regardless of their initial size. Finally, we arrive at E for evolving. This is arguably the most important criterion. Evolving means any change in a mole's size, shape, color, elevation, or any new symptoms such as bleeding, itching, or crusting. A mole that starts to evolve, to change in any noticeable way over weeks or months, is a major reason to see a doctor without delay. It's the dynamic nature of the change that's key here. It's not just what a mole looks like right now, but how it's behaved over time. Think of it as a mole that's no longer quiet and unassuming, but suddenly demanding attention. For instance, my aunt had a tiny, flat mole on her arm for years, completely unremarkable. Then, over a few months, it started to itch persistently, and she noticed its edges seemed less defined. She almost brushed it off as dry skin. But that persistent itch finally prompted her to see her doctor. Turned out it was an early-stage melanoma. Caught just in time. Her vigilance and listening to that tiny, insistent symptom made all the difference. It's also important to remember that melanomas can appear as entirely new spots, not just changes in existing moles. So, conducting regular self-checks, perhaps once a month, where you examine your entire body, including areas not exposed to the sun, like your scalp, between your toes, and under your fingernails, is incredibly vital. Use a full-length mirror and a hand mirror to help you see those hard-to-reach places. If you find anything suspicious using the ABCDE rule, or a new spot that simply doesn't look right or doesn't heal, make an appointment with your GP or a dermatologist. Don't wait. A prompt check can be life-changing. Now that we've discussed the critical signs related to moles and new lesions, let's move on to other types of skin changes that might not fit the ABCDE pattern, but are equally important to recognize. Moving on from moles and the ABCDE rule, let's explore some other skin changes that are incredibly common, especially as we age, but can also be silent indicators of something more serious. These often get mistaken for age spots, benign growths, or even just persistent blemishes, but they too deserve our full attention. We're going to talk about two other prevalent forms of skin cancer: basal cell carcinoma and squamous cell carcinoma. While generally less aggressive than melanoma, they are far more common and still require early detection and treatment. Let's start with basal cell carcinoma, often abbreviated as BCC. This is actually the most frequently diagnosed type of skin cancer. You might be surprised at how innocuous it can look. Often, BCCs appear as a pearly or waxy bump on the skin. Imagine a small, translucent lump, sometimes with tiny visible blood vessels within it, almost like a miniature pearl embedded in your skin. These bumps can sometimes be flesh-colored, or they might have a slight brown or black tint, making them look a bit like a harmless mole or a particularly stubborn pimple that just never seems to go away. Another common presentation of a BCC is a flat, flesh-colored or brown scar-like lesion. This can be particularly deceptive because it doesn't look like a raised bump at all. It might just seem like an old scar or a patch of slightly different texture on your skin. These often appear on sun-exposed areas like the face, ears, neck, scalp, shoulders, and hands. A critical red flag for BCCs, whether they are pearly bumps or scar-like patches, is that they might bleed easily, especially after minor injury, and then fail to heal. Or they might scab over, only for the scab to fall off and the sore to reappear, stubbornly refusing to close up completely. I remember a gentleman who came to mind. He had a small, reddish spot just below his eye that he kept picking at, thinking it was a stubborn zit that would eventually clear up. It would bleed a little, scab over, and then the scab would come off, only for the cycle to repeat. After several months, his wife finally insisted he get it checked. It was a BCC, and while it was easily treated once caught, the delay meant it had grown larger than it needed to be. His story truly highlights the importance of any non-healing sore. If it won't heal within a few weeks, especially in a sun-exposed area, it needs medical attention. Now, Let's move on to squamous cell carcinoma, or SCC. This is the second most common type of skin cancer, and it also primarily develops on sun-exposed areas of the body. SCCs often appear as a firm, red nodule, which can sometimes be tender to the touch. Unlike the pearly look of BCCs, SCCs can have a scaly, crusted, or even wart-like surface. Imagine a persistent red patch that feels rough to the touch, almost like sandpaper, and might have a crusty top. It might also bleed or become inflamed. Sometimes, an SCC can look like an open sore that doesn't heal, or a raised growth with a central depression. These lesions can be quite uncomfortable, sometimes itching or bleeding with little provocation. What makes SCCs particularly concerning is that, while most are not life-threatening, they have a higher chance than BCCs of spreading to other parts of the body if left untreated. So, early detection is absolutely key. Consider another example. An elderly woman had a patch of rough, scaly skin on her lower lip that she attributed to years of sun exposure and dry lips. She'd apply lip balm constantly, but it never fully went away. It wasn't painful, but it felt rough and would occasionally crack. Eventually, a friend noticed how persistent it was and urged her to get it looked at. It turned out to be an SCC. This is a common story. People dismiss these changes as benign, just part of getting older, but they can be vital signals. So, when you're doing your skin checks, or just going about your day, pay attention to any new bumps, spots, or patches that are pearly or waxy, especially on sun-exposed skin, look like a flat, firm, pale, or yellow scar, are red, crusty, or open sores that don't heal within 2 to 3 weeks, are raised, firm, red nodules, or scaly, crusty patches that might look like a persistent wart, bleed, itch, or hurt. The difference between a harmless blemish and a potential skin cancer often lies in its persistence and any changes it undergoes. If something on your skin is new, changing, or simply not healing as it should, it's always better to err on the side of caution and get it checked by a healthcare professional. Now that we've discussed these specific types of common skin cancers, next, we'll dive into other, even more subtle changes that might seem like minor irritations, but truly deserve our full attention. As we continue our exploration of what your skin might be trying to tell you, let's consider some changes that are even more subtle than distinct moles or obvious bumps. These are the kinds of skin signals that can often be dismissed as simple aging, dryness, or just a bit of wear and tear. But ignoring them can mean missing an important opportunity to intervene early. One of the most common and often overlooked conditions is called actinic keratosis, sometimes abbreviated as AK. These are not yet skin cancer, but they are considered precancerous lesions. Think of them as a warning sign, a rough draft of future trouble. Actinic keratoses appear as rough, scaly patches on sun-exposed skin. They often feel like sandpaper when you run your finger over them. They can be flesh-colored, reddish, or brownish, and they might be slightly raised or flat. Common locations include the face, scalp especially if you have thinning hair, ears, neck, hands, and forearms. The tricky part about AKs is that they might not look very alarming. They can be subtle. You might notice them more by feel than by sight. Imagine you're running your hand over your forehead or the back of your hand, and you encounter a patch that just feels persistently rough. Even after applying moisturizer, it's not just dry skin that flakes off easily. It's a deeply embedded rough texture. While not all AKs will progress to squamous cell carcinoma, a significant percentage of SCCs do develop from existing AKs. So, identifying and treating them early is an important preventative measure. A dermatologist can easily identify and treat AKs with various methods, from freezing them off to topical creams. The surprise here is how incredibly common these are, especially for anyone over 60 who has had a fair amount of sun exposure throughout their lives. and how easily they are dismissed as simply old skin. Your vigilance in feeling your skin, not just seeing it, is incredibly powerful here. Beyond specific lesions, it's also crucial to pay attention to general changes in your skin that might seem unrelated to spots or growths. This includes things like persistent itching or unexplained rashes that don't respond to typical remedies. While most itching or rashes are due to allergies, dry skin, or other benign conditions, in rare cases, persistent, widespread itching or unusual rashes that don't go away can be a symptom of an underlying internal cancer, such as lymphoma or certain types of liver or kidney cancers. It's not common, but if you have a rash or itching that lasts for weeks or months without a clear cause, and especially if it's accompanied by other symptoms like fatigue, unexplained weight loss, or swollen lymph nodes, it absolutely warrants a conversation with your doctor. Your skin can be a window to what's happening inside your body. Similarly, be mindful of any sores or wounds on your skin that simply do not heal. We've touched on this with BCCs and SCCs, but it bears repeating: a cut, scrape, or lesion that persists for weeks or even months without showing signs of healing, despite proper care, is always a cause for concern. Your body is designed to repair itself, and if it's failing to do so, there's a reason. It could be an infection, a circulation problem, or indeed, a silent cancer. The overarching theme here is the power of observation and consistency. We've talked about moles that change in their ABCDEs, those that are asymmetrical, have irregular borders, varied colors, a larger diameter, or are evolving in any way. We've discussed new bumps that are pearly or waxy or flat, scar-like patches that bleed and won't heal, which could signal basal cell carcinoma. We also covered firm, red nodules or scaly, crusty patches that might look like stubborn warts or sores that indicate squamous cell carcinoma. And finally, those rough, sandpaper-like patches known as actinic keratoses, which are precancerous, and the importance of paying attention to unexplained, persistent itching or non-healing sores that could signal something systemic. It's not about living in fear, constantly scrutinizing every inch of your skin with anxiety. It's about cultivating a relationship with your body, a gentle curiosity and attentiveness. Make it a habit to glance over your skin regularly, perhaps once a month after a shower, using a full-length mirror and a hand mirror to check those hard-to-see areas like your back, scalp, and the soles of your feet. If you have a partner or a trusted family member, ask them to help you check your back, which is often a blind spot. And remember, while self-checks are incredibly empowering, they don't replace the expertise of a professional. If you notice any of these signs, or if anything on your skin just feels off or concerns you, trust that instinct. Make an appointment with your GP or a dermatologist. They have the training and tools to properly assess any suspicious spots and provide accurate diagnosis and treatment if needed. Many dermatologists recommend an annual full-body skin check, especially for those over 60 or with a history of significant sun exposure, numerous moles, or a family history of skin cancer. This professional check can catch things you might miss. I genuinely hope this conversation has given you valuable insights and empowered you with knowledge that can truly make a difference in your life. And the true surprise: it's not a complicated medical test or a breakthrough drug. It's the profound power of your own observation, your own everyday vigilance, and the simple act of truly knowing your skin. That consistent, gentle self-awareness is your most powerful tool in the fight against silent skin cancers. If anything we've discussed today has resonated with you, or if you have your own experiences to share, please don't hesitate to leave a comment below. Your stories and insights can truly help others in our community, fostering a shared sense of awareness and support. And if you found this video helpful, please give it a thumbs up. It really helps us reach more people who need this important information. And, of course, subscribe to our channel for more content dedicated to helping you live your healthiest, happiest life. Remember, Your skin is your body's largest organ, and it's constantly communicating with you. Listen to it, trust your instincts, and always advocate for your health. You deserve to live your best life, vibrant and healthy, at every age.